In this lecture, I'm going to discuss the clinical manifestations of diabetes. This is lecture number 2 of the diabetes series. By the end of this lecture, you should be able to 1. List the clinical manifestations of diabetes. 2. Relate some of the signs and symptoms to the pathophysiology of diabetes. Normal blood glucose level is between 65 to 99 milligrams per deciliter. To know the symptoms of diabetes, you must think of the principle of homeostasis. Homeostasis in this case means that the body will attempt to return glucose levels within a normal range. As you may recall, in diabetes, there is too much glucose in the bloodstream. This will trigger the thirst mechanism and cause the person to drink lots of water in an effort to bring the glucose concentration down. This is polydipsia. Because the person is drinking a lot, he will be peeing a lot, which is polyuria. The other mechanism that brings about polyuria in diabetes is glucose pulls in fluid from the interstitial spaces into the bloodstream and eventually to the kidneys to produce more urine. Because the cells are starved of glucose, this causes excessive hunger and increased appetite, which is polyphagia. Despite polyphagia, people with type 1 diabetes will lose weight because the body is using its own reserves of glucose, protein, and fat as energy. So you have the classic symptoms or manifestations of diabetes: polydipsia, polyuria, polyphagia, and weight loss. Other manifestations include fatigue. Remember that glucose produces ATP, which is the cell's energy fuel. With diabetes, glucose entry into the cell is impaired, and so there is no ATP or lack of ATP, and there is no energy. In women, high sugar levels may cause frequent vaginal infections such as yeast infection or urinary tract infection. Glucosuria, which is sugar in the urine, contributes to vaginal infections. Glucose in the urine is conducive to bacterial growth. Diabetes also causes nerve damage, which causes numbing, tingling, and burning sensation, mostly in the feet or lower extremities. Diabetes also is a major risk factor for peripheral artery disease or peripheral vascular disease. Diabetes, especially uncontrolled diabetes, causes changes in the blood vessels, which lead to poor circulation. Poor circulation then leads to wound taking a long time to heal, and in men, they may not be able to get an erection. That's the end. Thank you.